towards the late teens, early 20s. And it's much less clear what's going on there. With social phobia, it may be to do with a continuation of shyness, so shyness sort of essentially being exaggerated to the point of interfering with a person's life. Agoraphobia is often caused by the occurrence of panic attacks, where the person is afraid of experiencing panic attacks in particular places, so doesn't go to those places. For specific phobias, phobias of particular objects or situations, then the treatment always involves some type of exposure, which is confronting the thing you're afraid of. For spider phobia, snake phobias, small animals and so on, that treatment can be done in the space of 3 hours. Highly successful. Almost everybody gets better and stays better pretty much forever. If people have a phobia and there's signs that it's getting worse, which typically happens with things like social phobia and agoraphobia, then it's really important that you seek treatment, usually cognitive behavioural therapy. The really good news about phobias is that they're all treatable. With specific phobias, very brief treatment is going to get pretty much everybody completely cured. With social phobia and agoraphobia, the process is a bit longer, but again, cognitive behavioural treatments are highly effective and nobody really needs to suffer from this problem.
My name is Dr. Amit Allahabadia. I'm a consultant endocrinologist based at the Sheffield Teaching Hospitals in Sheffield. The thyroid gland is a very important gland which is located within the neck. It produces two main types of hormones. One is known as thyroxine or tetraiodothyronine, and the other one is known as triiodothyronine or T3. There are three main causes of an overactive thyroid gland within the United Kingdom. The most common condition by far is a disease known as Graves' disease, which accounts for about 3/4 of all cases of an overactive thyroid gland. Less commonly, patients may have a toxic multinodular goiter or a condition known as a toxic adenoma, in which they have a nodule within the thyroid gland that overproduces thyroid hormone. Hypothyroidism is a relatively common condition and amongst the most common of all endocrine conditions known. Overproduction of thyroid hormone makes patients feel generally quite unwell and leads to a number of symptoms. Probably the most common symptoms are weight loss, feeling tired. Very occasionally patients feel they have more energy, but it's more common to feel tired. Other common symptoms include having awareness of an increased heart rate or palpitations, feeling shaky, and disturbances of mood, particularly irritability or anxiety. Patients may also have more noticed difficulties with breathing, and ladies may have problems with menstruation, with periods often becoming less frequent or stopping altogether. Patients may also have bowel problems and find that they have to visit the toilet more frequently. The aim of treatment in most patients is to give a course of antithyroid drugs for a period of several months in order to try and induce a remission of the underlying problem that causes Graves' disease. Patients are started on antithyroid medication, and either that medication is titrated according to their blood tests, or they have one set dose given, and when thyroid hormone levels return to within the normal range, patients have thyroxine given in combination with their antithyroid medication. These two methods are known as either a titration method or a block and replace regimen. Most patients who are started on antithyroid medication tolerate the treatment well. They may occasionally get mild side effects such as a skin rash or joint aches and pains, which often subside spontaneously. The treatment is given for anywhere between 6 and 18 months, and at the end of the course of treatment, drugs are stopped, and it is seen at that point whether the Graves' disease has settled down and the overactive thyroid gland goes away. Once the course of antithyroid treatment is stopped, and if the patient's Graves' disease doesn't go into remission and the overactive thyroid returns once again, the main treatment options for curing the overactive thyroid gland are either to give a treatment known as radioiodine, which is given to try and destroy thyroid cells which overproduce thyroid hormone, or to perform an operation to remove the entire thyroid gland. The only common side effect of radioactive iodine treatment is the development of an underactive thyroid gland or hypothyroidism. This can be expected in about half of all patients 1 year after treatment, but there is the risk of developing hypothyroidism long term, and this can occur in 2 to 3% of patients every year after they have radioiodine treatment. Patients who have surgery for Graves' disease are usually treated with a near total thyroidectomy to remove most of the thyroid gland. Such patients will always require thyroxine treatment for the rest of their life after surgery to ensure that their thyroid function remains normal. In patients who have a multinodular goiter, again, like Graves' disease, they will usually have all of their thyroid gland removed. Patients who have a toxic adenoma due to a nodule which is producing too much thyroid hormone may be offered removal of part of their thyroid gland. In such cases, thyroid function may remain normal, or in the long term, some patients may become hypothyroid and require thyroxine treatment.
Asthma is a chronic long-term condition that can be managed but not cured. Asthma affects the airways of your lungs. It causes the airways to narrow and swell, resulting in wheezing and difficulty breathing. During breathing or respiration, air goes in through our nose or mouth to the upper airways, at which point it reaches the windpipe, which branches into 2 large bronchi to reach the lungs. The lungs are protected by the rib cage, which also contains the muscles that control your breathing. In asthma, the airways are oversensitive and easily irritated by certain triggers, called asthmatic triggers. Most people with asthma are described as atopic, meaning they have an allergic type reaction to external triggers, such as house dust mites, pollen, cigarette smoke, animal fur, and chest infections. However, for some people, the onset of asthma is unpredictable and may be caused by anxiety, stress, or even laughter. An asthmatic trigger causes the airway walls to swell and the muscles around the airways to contract. The airways narrow, and breathing through them produces a whistling sound called wheezing. Mucus is produced from the lining of the airways, which clogs up the narrowed airways further and causes coughing. This makes normal breathing more difficult, producing symptoms of asthma that can be mild, moderate, or severe and life-threatening, where hospital treatment is needed. The narrowing of the airways is reversible if the trigger is removed, or if the inflammation is treated medically. Therefore, preventative treatment is used and can be managed by the patient themselves. An acute asthma attack requires medical intervention, but the type of intervention depends on the severity of the attack.
Hi, I'm Dr. Pam Brown. I'm a GP in Swansea, and I also work in an osteoporosis clinic in the hospital in Swansea. Our bones grow throughout the early part of life, And then later in life, from about the mid-30s onwards, we begin to lose bone. So it's important that we've got lots of bone in our skeleton at that stage. Our bones are healthy because they provide us with support and allow us to protect some of the organs within our body that are really important. And the main reason for keeping our bones healthy is so that we don't have fractures or broken bones, particularly later in life. The way that we can protect them is to lead a healthy lifestyle throughout life, really from the cradle to the grave. So that involves eating a healthy diet which is rich in calcium, having plenty of sunlight exposure to make vitamin D in our skin, and ensuring that we take vigorous exercise early in life and more gentle exercise to stop us from having falls later in life. The ideal exercise is resistance type exercise that we can do in the gym or doing aerobics where we're actually stressing the bones in our skeleton quite a lot. Calcium is an important component of bone along with protein and other fibre type structures that make the bones strong. We can get lots of calcium, particularly from dairy produce. Skimmed milk contains more calcium than full fat milk, so we can drink plenty of milk and protect our bones while still protecting our heart and sticking to a low fat diet. We also can get calcium from other sources like calcium added soya milk if we're not able to take dairy produce. And a variety of green leafy vegetables have got calcium as well, although that's a little bit more difficult to get large quantities. The main health problems associated with bones are osteoporosis, where the bones become thinner and much more fragile. And this begins to happen from about the 50s onwards in many people. We also have problems with joints which are completely separate, and it is important to differentiate between osteoarthritis, which affects our joints and causes pain, and osteoporosis, which affects our bones, our skeleton. In terms of symptoms for osteoporosis, usually there aren't any until someone has their first fracture, and that silent nature of the underlying disease while the bones are getting thinner is really a problem and makes it hard for people to know whether they've got the disease. When somebody begins to develop osteoporosis, usually it starts off very mildly and the progression can take many, many years. Although sometimes, particularly in men, osteoporosis can progress very rapidly so that people start having one fracture and then very quickly thereafter have further fractures. Even at the late stages where someone's had a lot of fractures, there's still much that can be done to treat the condition and prevent further fractures. There are 4 main groups of treatments that we can use for osteoporosis. The first of those is calcium and vitamin D taken in high dose as a supplement, as opposed to getting calcium from the diet and vitamin D from sunlight exposure. And really anybody that has osteoporosis or needs treatment for their osteoporosis to prevent fractures should have calcium and vitamin D along with another treatment. The next category and the commonest drugs that are used are bisphosphonates, and these are a tablet that's taken once a week generally or once a month, but it has to be taken in a very careful way to make sure that the drug is absorbed and has a benefit for protecting bones. So in summary, it's really important to do the lifestyle advice throughout life: healthy diet, good exercise, avoiding smoking and moderating alcohol. And the really good news is that we have such a huge range of drug treatments available for osteoporosis that once you've had a fracture and you seek the correct diagnosis, we can always do something to reduce your risk of future fractures. So it's really worth seeing your doctor or your nurse and talking about your individual risk.
Hello, I'm Dr. Rupal Shah. I'm a GP at the Bridge Lane Group Practice in Battersea in London. A practical way to define diarrhoea is passing stools which are looser or more frequent than is usual for you. If the diarrhoea is caused by an infection, you might find that you also have a fever or nasty stomach cramps. Diarrhoea can cause a problem if it's very frequent and it results in you becoming dehydrated. So it's always important to make sure you are maintaining an adequate fluid intake whilst you're suffering from the symptoms. There's many causes of diarrhoea and it's difficult to list all of them. There's different causes according to how old you are, for example. A lot of diarrhoea is caused by an infection which you can pick up from food or from contact with somebody else who's affected. If you're quite unwell with the diarrhea, for example, if there's blood in the diarrhea or if you have a high fever or generally unwell, then it's worth seeking a second opinion. Although there are many different causes of diarrhea in children, the most common cause is certainly infections. It's important to